Standard Bank Top Women Virtual Conference has kicked off. In fact, yesterday. It continues today. The two-day conference brings 10,000 women entrepreneurs and leaders in both the private and public sector together. One of the keynote speakers is Eva Mwai, the director of North Star Alliance. She was named among the top 100 most influential people in gender policy in the world. In fact, she joins us now live from Nairobi in Kenya. Eva, it's so wonderful to talk to you this morning on such an incredibly important issue. I think perhaps as a start, tell us more about North Star Alliance and what it does.
Thank you very much. It's a pleasure to speak this morning. North Star Alliance is a public-private partnership whose mission is to provide quality healthcare to mobile workers and the communities they interact with. We work in Africa along the transport corridors.
Mm-hmm. So in terms of the quality healthcare provided, in terms of mobile quality healthcare being provided to communities, how did that come about?
It came about following a need that was identified in Southern Africa, Malawi, when the UNWFP was doing some work with TNT, logistics company, and they realized that the number of truckers was becoming less and less with time. And when they did some assessment, it was clear that health issues, HIV especially, were affecting the truckers so much, and many of them were dying. And so the supply chain, the transport supply chain was badly affected, and that would of course be disastrous to movement of goods and ultimately the economies of the nations.
So the challenge was so severe that TNT Transport, who was doing CSRI work in Malawi, actually became concerned that the number of truckers would diminish to the point where it would impact supply.
Yes, precisely. And if you consider that everything that we have, the commodities that we use, medicine, clothing, food, is all transported by road, even if it comes by air or sea, at one point the road will be involved. So unless we ensure that the supply chain is healthy and safe for this kind of trade, then I don't know what the world and the service, the delivery would actually be like.
So the idea came about to actually convert shipping containers into clinics for truckers, but I understand it's now been extended to include benefits for the broader community.
Yes, precisely. Actually, if you look at the innovation that North Star Alliance initiated in those years in 2006, converting sea containers, the containers resonate very well with what the drivers do. They transport containers every day. And then it is cheap, it is low cost. You can relocate it should the locations require to be moved from one place to the other. And so we found that to be essential in the work that we do, providing health services to the communities. That's the significance of the converted sea containers, which we actually refer to as blue boxes.
Yeah.
They are painted blue.
Yeah. And what's the scope of the health care that communities can access through these blue box clinics?
It's comprehensive, I must say, because from the beginning, it was, a learning experience. And the first thing we did was to deal with HIV, sexually transmitted infections, because there's a lot of activity and sexual activity as well, where the trading centers along the corridors are. And so we focused more on HIV prevention, STI prevention. And then with time, we realized that, just providing a few services was not adequate. If a driver moves from one country to the other, from one location to the other, and they are moving this big trailer, it is very difficult for them to veer off the road and go looking for health services.
Yeah.
So we felt obliged to increase our service scope and included primary health care. We included, services like even TB screening and treatment. And as we speak now, have not just HIV testing services, but also ART initiation and treatment, and a myriad of other actually services, malaria, ailments, stomach, headaches, and just to ensure that the driver is able to move from one place to the other as quickly as possible without a lot of distraction on the highways.
Yeah.
And then I think one thing that we considered is that we need to include and open the blue boxes for not just the truck drivers, but also the people they interact with. The communities, the women traders, the men traders at the trading centers, sex workers included. And so, because diseases, when they travel with people from one place to the other, of course, they will infect all the people that they interact with. So you cannot be effective if you're just focusing on one target group and leaving the other, because they are all, interacting at that trading center.
And in terms of, the COVID-19 pandemic, I take it that the scope of services over the course of the pandemic also included COVID-19 insofar as perhaps testing, treatment is concerned. Is that right?
Yes, some of our clinics, especially in South Africa, will do testing for COVID, and that was a disruption that actually found us unawares, but we are very quick because we understand the environment very well. We decided very quickly to keep the blue boxes open and continue providing services. So we screen for COVID, and some of our clinics do the testing as well.
Eva, before we let you go, the two-day conference that continues today, kicking off yesterday, this Standard Bank Top Women virtual conference. So it's an opportunity for women like yourself to network with other women entrepreneurs on the continent. What are you hoping to get out of it?
I want to learn. I want to grow in many areas, from the rich program with many people endowed with a lot of knowledge. I believe that I'll be a better person after this conference. And of course, not just me, but thousands of others across Africa and other places.
Wow, what an incredible perspective there. Eva Mwai, thanks very much indeed for your time this morning on the AM report, Blue Box Clinics. Such an incredibly important initiative. Thanks very much for joining us indeed.